News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. If you or a loved one are suffering from trauma, you'll want to watch our show today. Our expert guest is Dr. Vicotia Follette. Dr. Follette is the author of this book, Finding Life Beyond Trauma, an excellent book. Dr. Follette is the foundation professor and chairman of the Department of Psychology at the University of Nevada, Reno. And Dr. Follette has studied trauma for over 25 years, taking a look at the effects of long-term risk related to trauma, as well as effective therapies. And Dr. Follette, we're so glad that you're here with us.
Thank you for having me. I'm very pleased to be here, and please call me Victoria.
Okay, all righty. So Victoria, it seems like we're hearing more and more about trauma now. Is that happening more? Are we just hearing about it more? Can you help us understand this, please?
Well, that's a great question. You know, there's been a lot of thought that maybe people are just exaggerating things, or that somehow we're just more sensitive to these issues. And in fact, issues of awareness about trauma have been around for a long time. And I think we're just more educated about the symptoms of trauma, and also that we're trying to get away from the stigma of people talking about their trauma. So I don't think that there's any more trauma. I think that it's just more of a comfortable subject to talk about than it was back many years ago.
Yeah. Staying with that thought about maybe the stigma, there are some people who maybe are afraid to talk about how they've been traumatized, because people will just say, well, you're just playing the victim card.
Right, exactly.
Or why don't you just buck up?
Right,
or it really wasn't that bad.
Right.
Can you tell us more about that dynamic that happens in families or in our culture, please?
Well, I think that a lot of times people are really uncomfortable with trauma because there's a lot of shame about what might have happened around abuse that happened in the family of origin, because people feel like they should be able to deal with it. Like combat veterans oftentimes feel like if they were really tough, this wouldn't bother them. And so people have learned to not talk about it. And another issue for people is that that we're uncomfortable sometimes when people talk about their trauma, because people don't know what to say or how to help. And so part of this book was talking about it and providing an avenue for people to say it's okay to say this happened to me, and that there are things we can do to help people.
Now, Victoria, you mentioned combat veterans, but I think there are a lot of other ways that we human beings can be traumatized. Can you give us some ways maybe to help other people understand what might have happened?
Certainly some of the leading work in this area was done studying rape survivors, and that led to looking at issues around childhood abuse and childhood physical and sexual abuse. And people did not start talking about that too much until in the 80s. But we also have all kinds of trauma experiences. So in the 1800s, they talked about something called railway spine, which was actually just a phenomenon associated with being in transportation accidents, railroad accidents at the time. But of course now we see airway accidents, natural disasters. So even though the event can be very different, many of the symptoms associated can be very similar.
Yes. And what are some of those symptoms?
Well, we see a variety of outcomes associated with trauma, sometimes something that we call post-traumatic stress disorder, and that can be associated with symptoms like avoidance, feelings of staying away from reminders of the event, trying to block out feelings and thoughts. We also see kind of the opposite side of the avoidance, which is the re-experiencing. So the nightmares, flashbacks during the daytime. And we also see symptoms that look like anxiety, the increased heart rate, increased startle response, people being very sensitive to having somebody behind them, those kinds of things. So there's a range of things, but we also see other kinds of symptoms besides just the PTSD. Some people will have symptoms of depression, anxiety, and sometimes it comes up in terms of how people relate in intimate relationships to other people. So there's a range of outcomes, and that's why we talked about finding life beyond trauma instead of just focusing on the PTSD.
Yes.
Being aware it comes up in lots of other ways
Yes.
for people.
And of course, there are other ways where people maladaptively address trauma with drinking or drug use and food. And we're going to explore this topic after this brief break to a much greater degree. We'll see you after the break. Hello and welcome back. We're talking with Dr. Vicotia Follette about healthy ways to deal with trauma. However, there are also unhealthy ways, and it's important that we understand those.
Right.
There's, well, please tell us about the unhealthy ways that us human beings can deal with trauma in an ineffective way.
Well, I think one of the biggest things that we're focusing on is how avoidance symptoms and patterns of coping come up in all kinds of ways. One of the ways that can come up is substance abuse and misuse and use of other strategies such as eating or spending or those kinds of things. But substance abuse, both alcohol and drugs, is one of the classic things that we see with trauma survivors. And it's very understandable. People are overwhelmed with pain that they don't know how to cope with. And so we're not looking to stigmatize people
Yes.
around that. We understand how that happens. And what we think is that it gets in the way of having the life that people want to have. So that substance helps numb out the pain, but it results in all kinds of other problems also.
Can you describe some of the other problems you've seen with your clients throughout the years? How what seems to be an answer actually just makes their life worse?
Well, so fleeing into substance, but I think you're asking about other things too. So maybe avoiding close, intimate relationships. People feel like they've been hurt so badly that one way to deal with things is just really to never let yourself be close to someone again. And of course, in some ways that wall or that barrier is protective, but you're cut off from the joy that relationships can bring also. Or fleeing into work. People can be very successful by working all the time and, you know, people pleasing and making others happy with what they're doing, but they've lost a sense of who they are and what the meaning is in their life. And so that's a kind of a funny paradoxical one where on the outside it looks like people are doing fabulous, but inside they're cut off and hurting.
As you're talking about that, Victoria, I was wondering, have you found that sometimes a description for someone who's been traumatized and they haven't healed from that or dealt with that, it's almost like they're walking dead? They've lost some spirit?
They have lost a sense of who they are and their sense of connection sometimes to other people, sometimes to their spiritual life. There's kind of a numbness that pervades people who've been through a huge amount of trauma.
To go back to an earlier topic we were discussing, everyone has stress and pain in their life, and what differentiates then someone that has normal stress and pain, which could be very stressful and very painful, from the person who is traumatized or in fact has PTSD?
Well, that's a great question, and if we could answer that, we'd be sitting at the Nobel Prize table or something. One of the things we know is that stress and pain is part of everyday existence. You can't really get out of life without experiencing some painful difficulties. But the suffering is when people get caught up and can't move to the next level. Now, one of the things we're studying a lot is what differentiates people, and we don't fully understand that, but we certainly know the tragedy of 9/11 has taught us a lot about the resilience factors we see in folks. So not everybody exposed to a trauma will have the long-lasting symptoms. There are people who have this resilience oftentimes through social support, through a spiritual connection, through having others reach out and take care of them until they get to a better place. So there's not always going to be a long-term problem associated with traumatic events.
So we have about a half a minute in this segment, and I'm wondering, Victoria, then the therapy that you use in this, it's ACT. Is ACT basically, is it kind of a resilience therapy?
Well, that's a great way to think about it. I think it's a way to find out about acceptance of what has happened and look for the way to move forward in your life to make meaning out of your next steps.
Okay. So from what you were just saying, it was reminding me about the idea of a tug of war. And when we get back after this brief break, we're going to ask Victoria about this idea of a tug of war going on inside of us. We'll see after the brief break. Welcome back to New Skills for Living. We're talking with Dr. Vicotia Follette, the author of this book, Finding Life Beyond Trauma. We're talking about dealing with trauma in healthy ways. So, Victoria, this paradigm of ACT, A-C-T, one of the things that I really liked that you addressed in your book here was this idea of acceptance, and maybe even acceptance around this issue of trauma might kind of shock some people. Can you tell us what you mean by that?
Sure, that's really important because people can misunderstand. We're not condoning what happened. We're not telling people that they have to be okay with the fact that somebody did something very painful or harmful to them. It's not resignation or putting up with. It's more a coming to a place of awareness of what's happened in your life and letting go of the struggle to get rid of it, because people get locked into this struggle. It's almost like a tug of war with your own history of you need to get rid of the bad stuff that happens.
Yeah.
But the more you're engaged in that tug of the war, the more you're caught and can't move to the next level, which we would talk about using the tug of war metaphor as putting down the rope, letting go.
So just stopping the struggle, just say that's it, huh?
Right.
And then kind of moving on with your life instead of engaging in the struggle.
Exactly, exactly. It's not about the struggle to get rid of your history's there. And it's looking for, and what is the next step? What are the things that you want to do in your life?
So maybe just to be more concrete, you mentioned earlier some of the people who are traumatized. Let's say someone who's been a rape victim, someone who's been beat up badly at home by their parents or their older siblings. So you're suggesting that the way out of this trauma is to accept what happened. And now, are you also saying forgive what happened, or?
I think that forgiveness is a really important question that's one to be worked out with the client. One of the things that really pulled me into this therapy, and I would say that Steve Hayes and my co-author Jackie Pistorello have been really important in helping me think through these processes, is I like that ACT is not a hierarchical kind of, you must do this to get better. We work with the client to help her or him understand what they want to do to get better. And some people want to work towards forgiveness, and for other people, that doesn't feel like a comfortable strategy.
Yes.
And it's our goal to help the client identify her goals and values, not to say you have to do this, because oftentimes people have been in situations where they didn't have the autonomy to define their lives. And so we want to say, help us to understand what's going to take you to the next level.
Yeah, and that's one of the really nice things about ACT and what you all have done with that. So the first thing is A, which is acceptance. The C, we might say, that's choose a direction. Can you tell us about that, please?
Yeah, I think a lot of that, and some of the acceptance work we do with a variety of mechanisms. We can do it around writing about your trauma or talking it through with someone and really getting some kind of resolution with that. But then you're looking at and choosing a direction. What do you want your life to be about? What are the things that matter to you? And we go through various domains like family relations, education, work, caring for others, being involved in your community. And what are the things that matter to you? And let's help choose some directions on the horizon that are meaningful directions for you.
So what I'm hearing is you're really sharing with people who have been wounded deeply, they're really hurting. Maybe they've given up, maybe they feel discouraged and hopeless. it sounds like you're offering them hope and empowerment, and you're saying you can have a life. Yes, you were wounded terribly, and you can have a life.
And that's exactly it. And that's the part of this work that's so powerful, is over the years I've seen so many people take back their life and really give back to others to overcome what seem like insurmountable obstacles. And so it's really enriching to me to see how people can move forward and make a sense of meaning out of even these painful things that have happened to them. Because one of the big things that I see is that people oftentimes come away wanting to help others. And they do it through all kinds of avenues. Sometimes it's through wanting to do therapeutic work. Sometimes it's through social advocacy in their community, through giving to charities. But what I see is this coming out of many trauma survivors is a sense of compassion and deep empathy for others.
Yes. And of course that is so important in the healing process and in all of us having a life, moving beyond our hurts and our pains. After this brief break, we're going to move into our fourth segment and learn more about healthy ways to deal with trauma. Hello, we're talking with Dr. Vicotia Follette, the author of this really good book, Finding Life Beyond Trauma. And so, Vicotia, we were talking about acceptance and choosing directions. Now we want to talk about taking action. That reminds me, earlier you were talking about instead of being in this tug of war with ourselves and with life, just letting the rope go and not being in the tug of war. And I guess that's where taking action comes in then, huh?
Exactly. I mean, one of the things that's, I think, really been useful to people about this treatment is it's not just about delving into the past and uncovering all the painful things. It's about the here and now, too. It's about saying, well, what do you want to do? Let's look at these values, and then we break those values down into concrete steps people can take. What are the specific kinds of actions that you can take? What are the barriers so that we can help people plan for things that'll get in the way? And then what's the direction you're going in, and really coaching people in taking those next steps.
Yeah. Now, as people are taking those steps, I'm beginning, and you were talking about barriers, I began to think about families. And of course, families are affected by the trauma of the family or of this individual person.
Right.
Can you talk with us about what goes on with families in this healing or therapy process?
Sure. We've actually done some work with couples over the years, because one of the things we've found is that we've worked with a number of women who have not been able to talk to their partner about their abuse. And that's actually one of the things that we work on with her is, what is her value about disclosing to her partner? We're not going to tell somebody she has to. It's what she wants to be about and what's going to lead to increased emotional intimacy in that relationship. If that's something she wants to work toward, we help her with that. And we've also helped partners. We help them talk about it, because oftentimes the spouse wants to be supportive, but they're not sure what to say that can be helpful. And so part of that process is helping partners to support their spouse as they're going through these changes, because it can be a rocky road.
Sure.
If you have a relationship that's built on many years of not talking about painful things, when you start opening that up, it's hard. And we see the same thing with combat veterans, where particularly men, but of course now we're seeing more women, have walled off tons of feelings, and it's scary to begin to open those up.
That's an excellent point. As you're mentioning that too, Vicotia, I want to mention to people that if you were to go to the bookstore or online, order this book, it is a workbook that Dr. Follette has designed along with her co-author, Jackie Pistorello. And so it's not just reading, but it's also using it as a workbook to work through many of the things that you've been talking about today. Can you tell us a little bit more than I have just about the value of your workbook as a tool for people?
Well, I think in many ways there's been so much talk about trauma, but what I've been worried about is how to reach the people who don't have access to treatment, the people who are maybe in rural settings or don't have the financial access, and how do you give people something that gives some fundamental tools, gives some hope, and yet is safe, because you don't want to push people real far when they're doing this work on their own. So in a lot of ways, the workbook is something you can use on your own, but I think it would be ideal to use with a therapist where you're getting some periodic support as you come across more painful, difficult issues. And that's how we've used it some at the university, and we actually have a psychology clinic that treats people from the community, sliding fee scale, and that's one place people can get services who have felt that they couldn't afford services, and especially right now when money's so tight for people.
So people can go up to the university and access help for their trauma and other issues.
Absolutely.
Now your email, I believe, is on screen along with your name. Can people email you if they're...
Absolutely.
Okay.
And we would be happy to. We have a doctoral training program in psychology, and we have graduate students who intensively work with clients, either in individual or group therapy. They're all supervised by the faculty. I have a group that I work with very closely. And we love being a resource for the community, particularly in times when there aren't as many mental health resources available.
Yes. Okay. Well, Victoria, in this last half minute, people have been watching us and with a great deal of interest. Some of them may be victims of trauma. What would you share with them about dealing with their trauma?
You know, there was a great quote that I think it was Helen Keller said, that the world is full of suffering, but it's also full of the overcoming of it. And that people through the ages have learned ways to cope with pain, and we're trying to bring in some of these very basic ideas and make them accessible to everybody.
Yes. Well, that is excellent, and thank you for that quote from Helen Keller. We want to thank you for joining us. Be back and watch us next month, too, as we continue to take a look at how acceptance and commitment therapy can use to make a positive difference in people's lives. You can see my website, I believe, up on the screen, and these shows are available on my website as well. Have a good month, take good care of yourself, and thank you for joining us.
Thank you.